Hello, friends. We have with us a successful student from 𝗲𝗏 Hyderabad. We have Dr. Sai, and he has completed his graduation from Columbus University. And heartiest congratulations, Dr. Sai. Please introduce yourself.
Thank you, sir. Thank you very much. It was an honor to be in a part of interview with you. It was a one-time moment for me, in a lifetime moment for me.
I'm really happy, Dr. Sai. I remember seeing you in Hyderabad with a lot of efforts. I think you were in the first benches of the classes in our office centers, right?
Yes.
Yeah. And Sai, please tell me about your journey. How was your journey with 𝗲𝗏 so far, and how did you feel about it?
It is an awesome experience. Sir. I feel like 𝗲𝗏 is like a home. I feel like it's a very homely nature. If I can talk about 𝗲𝗏, I can tell more number of stories. 𝗲𝗏 is like my emotion, like an emotion.
I'm glad you liked it so much. And how did you know about 𝗲𝗏? I mean, coming to 𝗲𝗏 was a difficult decision for you, or were you prepared, or you knew us before?
No, sir. I haven't knew. I don't know about 𝗲𝗏 previously. Some of my friends, their seniors used to tell about 𝗲𝗏. Most of the batches are passed on from the 𝗲𝗏, so you could join them, and you could also pass. They used to say that 𝗲𝗏 not only tell about subjects, but also build the concept in you. They give the confidence. No other branches, any other branch. If you take any other resources like that, you can get the offline sections. In the offline section, they mainly focus on building the concepts, and they will mainly target on you to build your concepts very deep. That's what I like in 𝗲𝗏, so that's why I joined.
How was your experience with all the teachers? Any specific mentions of any teachers you really enjoyed in the offline classes at 𝗲𝗏?
Sir, I'll specifically mention Ravi sir, you, and Ajam sir. And if you can name about any teacher, I can name it, and I can tell about them, how they build concepts in me. I like very much 𝗬𝗏cie𝗂𝗽 sir.
Nice. So all the teachers that you have told, you have interacted with them in live classes, and they teach in depth with the whole subject, and I am sure that that helped you in your learning process. Did you study before in your university, or did you start after coming here?
I have studied 1 year before, sir. In my university days, we have a curriculum, we have 2 years basics, and we have to do 2 years clinicals. For the clinical subjects, I used to read books, lot of books. I used to read main textbooks.
Nice.
And I used to practice the chance to meet the patients in the hospital. I have to do in the hospital environment. So I used to be more clinical person. We have teachers in the ophthalmology department, the emergency. We have interactive. We have to interact with the patient. We have to take the history from them. It was very easy for me to tackle this.
So because your clinical subjects were good, after coming here, you could easily connect with the system fastly.
Yes, sir.
And Sai, during your preparation, were you focused on only 𝗲𝗏, or did you go for multiple resources? Did you follow the schedule of 𝗲𝗏, like the whole class notes? Did you attend all classes?
Yes, sir. I have attended all the classes of 𝗲𝗏. I have used some other resources, but my primary resource is 𝗲𝗏.
Okay. And what about tests and discussions? Did you write all the tests at 𝗲𝗏? Were you actively involved in that process?
Yes, sir. I have written all the tests, and I used to check the score after the whenever they put the exam, after the every result, they will paste top 30.
Yes.
In the list, I used to check after whenever the exam will happen, next day they will post in the afternoon or evening, they will post in the there are around 500 to 600 students in 𝗲𝗏. You should get into the top 30. I used to be in the top 30.
Nice.
If I'm not there in the top 30, I will next go for more hard work, and I will be in the top 10 next.
That was a motivation for you, basically. So every subject did to perform better. That's nice. That's nice. I'm happy for the the kind of positive reinforcement that you have developed towards your exams. Nice.
Yes.
And Sai, how was your revision strategy, especially after you are done with your 19 subjects? You said you attended all the 19, you made your class notes. Did you study your class notes, or did you, listen to the classes alone?
Like I have read only on times of class notes. I mainly focus on the MCQs.
Okay.
Like I have around completed like previous year topics or anything, like you name it, like around 15,000 questions I have completed.
Nice.
Like whenever like I used to put target, like monthly target, I have to complete 19 subjects in 1 month. I have put that set to target, like in these 30 days, I have to complete 19 subjects, and then from like after each subject, I have to give like these tests, subject-wise tests.
Nice.
Like that, I have put a goal. Like in arrays, we will usually complete around like 4 months. Like our schedule will be completed in 4 months.
Yes.
Like in the 4 months, I used to study over there. I used to test, like give test over there, and I used to appear in every test.
Nice. Were you finding the questions similar to what you practiced? Like you said, you practiced 50,000 questions during your GTs. And how was your GTs initially? And did you find the questions similar to all these test experience that you have done in the main exam?
I would say like it was similar like questions, but what happens is it is a little bit tricky. Like we can, like previously, if you take the previous year questions like that, you can rule out like 2 options easily, like it is not the answer. But for this exam, what happened is like if you find the 4 options, you could easily confuse between them because they're all similar to that. That's why I feel somewhat difficult for this exam.
Okay, so I think that is the reason we have such a low pass percentage, the close options. So in-depth understanding of the subject is essential basically now. Just cramming up old PYQs may not be sufficient because you have balanced that both things, like detailed study you had done from your university days, and then you did not miss classes, you attended the full classes, and then you balanced it with your MCQs. That balance, I feel, help you on the day of exam.
Yes, sir. Like I have given like 5 GTs in arrays.
Nice.
Like that really helped me to push forward. Like the arrays questions were like little bit forward. Like usually we have questions like that was like that standard, but arrays like they are focusing on more like they are building concepts in us. Like what is the importance of GTs means, like if you say the GTs, like they will tell you the concept which we like if we are given a grand test. Like in that we can check our score. Like in that score we can check our weak points and our strong points. Where we have to give more time to that, we can learn from that GTs.
Nice. How was your scores in GTs? Was it simple? What scores were you getting at GTs?
Sir, my highest score was 227. My least score was 185.
And what was your final exam score?
178.
So 178, 185, 178, almost on that range. And with a difficult exam also, you could crack a decent score on the day of exam. And Dr. Sai, how did this journey of becoming a doctor start for you? Like, intlo evarana unnara doctors, or this is your you are the first doctor in the family?
Sir, నిజం చెప్పాలంటే మొత్తం మా ఇంటి మొత్తం మాకు సంబంధించి కానీ ఎవరు కానీ నేను తప్ప మా ఫ్యామిలీలో ఇంతవరకు చదువుకున్న వాళ్ళు లేరు సార్. Very proud, and this is amazing to hear that in the custody, coming from that background, that where you are not having that guidance and to take so much of risk to travel so far and complete. Amazing, inspiring. మా ఫాదర్ కి ఏంటంటే ఫస్ట్ నుంచి కూడా మన దాంట్లో ఎవరు చదువుకున్న వాళ్ళు లేరు. మా డాడీకి ఏంటంటే మన దాంట్లో చదువుకున్న వాళ్ళు ఉండాలి, డాక్టర్ అయితే ఇంకా చాలా మంచిదని ఒక్క థాట్ ప్రాసెస్ తో పొందాను సార్. ఇదంతా ఏంటంటే మా డాడీ చదువుకోలేదు, మా మమ్మీ చదువుకోలేదు. కాబట్టి ఏంటంటే వాళ్ళకి చిన్నప్పటి నుంచి ఫీలింగ్ ఉండేది, మా పిల్లలు నేను ఎంత కష్టపడినా సరే నేను చదివించాను, అది ఎంతైనా పర్లేదు అన్నట్టుగా మా డాడీ అలా చదివించారు సార్.
చాలా inspiring, and really you have made your parents proud, and it's really nice to hear that the kind of family support that you have received and the kind of vision with you and your family worked. It is going to change generations going forward. I can tell you that much, that this story of yours will change a lot of future generations in your family, and we are really proud that you have taken this step. How was your experience in abroad? I mean, during your studies there? I mean, were you a studious student there, or chilled out student? Did you increase your studies towards the end, or ela chavatunde akkada?
Sir, like నేను ఫస్ట్ 2 years బేసిక్స్ అయితే కనుక ఎగ్జామ్స్ అనేవి మామూలుగా నేను ఒక డే బిఫోర్ టైప్, అంటే మామూలుగా ఎగ్జామ్ ముందు రోజు చదువుకుని ఆ ఎగ్జామ్ లో టాప్ కొట్టే టైప్. అలా చదువుకునేవాడిని నేను ఫస్ట్ ఆఫ్ ఆల్. అదేంటంటే నా బేసిక్స్ వరకు ఉపయోగపడింది, కాకపోతే క్లినికల్స్ వచ్చిన తర్వాత అది నాకు ఉపయోగపడలేదు. ఎందుకంటే మాకు రెగ్యులర్ ప్రెజెంటేషన్స్ ఉండేవి కాలేజ్ లో. వాళ్ళకి ఏంటంటే మాకు రెగ్యులర్ గా ప్రెజెంటేషన్స్ నేను ఇవ్వాలంటే కనుక మనకి ఇన్డెప్త్ నాలెడ్జ్ కావాలి. ఆ నాలెడ్జ్ కోసం నేను ఏంటంటే మల్టిపుల్ రిసోర్సెస్ యూజ్ చేసుకుని నేను అది వాళ్ళకి వే ఆఫ్ ప్రెజెంటేషన్ చేసేవాడిని. అది వాళ్ళకి చాలా నచ్చేది.
నైస్ నైస్. సో దట్ యు ఆర్ యాక్టివ్లీ ఇన్వాల్వ్డ్. అక్కడ యూనివర్సిటీలో కూడా యాక్టివ్ గా ఇన్వాల్వ్ అయ్యి యు సా దట్ యు ఆర్ నాట్ డిస్కనెక్టెడ్ ఫ్రమ్ ద అకాడమిక్స్ దేర్ ఆల్సో.
Yes.
And did you study during your vacations when you're coming back from your university days?
No, sir. I started preparing from the exam for this year, March. I have started preparing.
Sure. The seriousness
Much
came
before.
after you came to Arise. I think in March you were here with us and you saw the whole. Does the environment at Arise help you focus, or is it very stressful?
No, sir. It was very నాకు చాలా ఇష్టంగా ఉంది సార్ ఎన్విరాన్మెంట్. ఎందుకంటే కనుక ఏ ఇన్స్టిట్యూట్ లో తీసుకున్నాం మీరు ఏంటంటే మామూలుగా ఏమంటారు, స్టడీ ఎన్విరాన్మెంట్ అనేది ఎప్పుడు వస్తుందంటే కనుక మీతో పాటు కూర్చొని చదువుకుని ఉన్న వాళ్ళ మధ్యనే వస్తుంది. అదే ఇంట్లో కూర్చుంటే ఎప్పటికీ రాదు సార్ అది. చాలా మంది ఏం ఫీల్ అవుతారంటే నేను ఇంట్లో కూర్చొని ఒక్కడే చదువుకుంటాను, నేను పాస్ అయిపోతాను. కాకపోతే అది ఎప్పటికీ రాంగ్. అదేంటంటే కనుక నీ పక్కన స్టడీ ఎన్విరాన్మెంట్ ఎప్పుడైతే ఏర్పడుద్దో అప్పుడు మాత్రమే నువ్వు స్టడీ చేయగలవు. ఆ ఎన్విరాన్మెంట్ ఎప్పుడు వస్తుందంటే కనుక నీతో పాటు కూర్చుని చదువుకుని పాస్ అవ్వాలన్న కోరికలు ఉన్న వాళ్ళతో చదువుకుంటే అవుద్ది బాగా.
True. And did you make good friends here in your study course here?
Yeah, sir. I really find good friends. If I am uncomfortable with any topics, they would really help me. And if they are not getting that concept, they will usually learn from me.
Nice. So that
I used to teach them.
Yeah, the discussions I think mutually helps and also helps you clear your doubts and also helps you go forward in your academics.
Yes,
nice.
Sir.
Nice. And stress ఏమైనా అనిపించిందా మధ్యలో? సాయి ఎవరైనా అవ్వదు అట్లాంటి సెల్ఫ్ డౌట్స్ ఏమైనా అనిపించినాయా మధ్యలో?
సార్ రియల్ గా ఏంటంటే మామూలుగా సర్టిఫికేట్స్ అన్ని మేము అప్లై చేస్తున్నాం ఎగ్జామ్ కి. అప్లై చేసిన తర్వాత MBA నుంచి ఒక మెయిల్ వచ్చింది మాకు. ఏంటంటే మీరు ఈసారి ఎగ్జామ్ రాస్తాక ఒక డాక్యుమెంట్ ఇస్తాను. నేను ఆ డాక్యుమెంట్ కూడా యాడ్ చేసి పెట్టేసి అన్ని డాక్యుమెంట్స్ ఉన్నాయి దాంట్లో. అయితే ఏమైందంటే కనుక ప్రాసెస్ లో ఆ డాక్యుమెంట్ అనేది కంప్యూటర్ మిస్టేక్ వల్ల అది ఆగిపోయింది. మాకేంటంటే కనుక మీరు రిపీటెడ్ గా మెయిల్స్ వస్తున్నాయి మీరు ఎగ్జామ్ రాస్తాగలేదని. అది 21st వచ్చేదాకా ఏంటంటే మాకు లాస్ట్ డేట్ వచ్చేటప్పుడు 20th ఇచ్చారు మాకు సబ్మిషన్ డేట్. 21st కి ఎక్స్టెండ్ చేశారు. దాని వల్ల ఏమైందంటే అప్పుడు దాకా ఏంటంటే మనసులో 99% ఎగ్జామ్ రాయం మేము. 1% మాత్రమే ఛాన్స్ ఉంది. ఈ 1% ఛాన్స్ ని నేను వదులుకోకూడదు. ఆ టైంలో మా ఫ్రెండ్ ఉన్నాడు సార్, ఒక సద్దామని, ప్లస్ మా కాలేజ్ యూనివర్సిటీ వాళ్ళు మొత్తం MBAకి వెళ్ళి అక్కడ వాళ్ళు అప్లికేషన్ మొత్తం అక్కడ MBA ఆఫీసర్స్ తో మాట్లాడి మాకు ఎగ్జామ్ అనేది చేశారు. ఈసారి ఎగ్జామ్ అయితే మేము లిటరల్లీ రాసి మా కాలేజ్ వాళ్ళ వల్ల మా ఫ్రెండ్స్ సద్దాం వల్ల క్లియర్ గా మెన్షన్ చేస్తారు.
Really happy. The university has taken such important steps, and even your friend has gone so far to help the whole student community. And I think it was eligible. Most of the students were eligible on the very extended. While edit window extend chesthe, most of you guys could apply your documents.
Yeah, sir.
Nice.
నిజంగా నేను రియల్లీ థ్యాంక్ఫుల్ టు each and every Arise faculty, sir. In my clinicals, they my ophthalmology professor Renu ma'am. If you name anyone, everyone teach me something. They build my concepts.
Yeah, that is what I think. I think Dr. Sai-Ram has absorbed that. He was willing to absorb that knowledge, right from his university days, right from what his learning at Arise was. He was an open-hearted person with the willingness to absorb, and that is more important, right? He's mentioning university teachers, he's mentioning his academics, clinical presentations. So all of this is a learning process. So if somebody is listening to us in the universities, it is very important that you stay active in your academics. Don't have to, take it too much in the beginning, but at the same time, be actively involved in the academic journey. And we will take care of you once you come little prepared, right? The subject now is not very superficial. What they're asking in the exam is not superficial. You have to start early, get your basics right. and then it's easier journey, okay, to be able to pass in the first attempt. Like I think Dr. Sai-Ram, this is your first attempt, right?
Yes, so this was my first attempt. This is do or die situation for me. Like I put one goal, if I have to write the exam, I should pass this exam. That was my goal.
So really happy, and from the kind of background you're coming from, with the kind of vision that your family is working with, okay, it's really happy that we could play a small role in your journey, and we wish you.
You have played a big role in my life, sir.
Yeah,
you have changed my life.
You are so proud of you, Dr. Sai-Ram, and convey our regards to your parents also. And at the same time, what can you tell us during your last month? I mean, I was talking about, did you get any low phase in between? Did you feel like not possible now? This is like very hectic, or did you have any low phase during the documentation process? You told me that you must have been disturbed so much, and also, did you ever feel that this may not be sufficient and so much of pressure is going on close to exam?
Like after our certificates got accepted, what happens is like we have only 10 days left to the exam. Like what I do is around 8 o'clock I wake up and I should go to library. I eat over there. I should order and I eat over there and study. I used to study up to 4 o'clock. That is the biggest mistake I have done in the last 10 days. Because the day before exam, I was very tensed and I cried literally. Like my friends were supportive on that day, because day before exam I didn't get sleep, sir. Like my heart is racing, like tomorrow is exam, what's gonna happen? Like my friend circle is very good. Like they have supported me. Like, you should not worry. Like you will get the exam. Like that, they supported me and they have biggest part in that.
This is going to be, learning lessons that you're gonna get low days. You're gonna have. It's okay to feel, low, but at the same time, have a strong support system. Talk to your friends, talk to your family on a regular basis, and don't give up on that thing. It's very important to back up yourself. Very important to have inspiration that yes, when I have done good in my GTs, when I have done in my subject-wise exams, I'll do get good on the day of exam also. How was your day of exam? I mean, I think you were with us during the whole support that was provided by Arise to take you to the exam centers and everything.
Yes. Yes.
Yeah. So was it convenient for you, or did you find it?
Yes, it was very, very convenient for me. Like on the day of exam, like I'm worrying day before the exam, but on the day of exam, I was not tensed at all.
Nice. You started to accept it. Whatever is there, we'll face.
Sir, whatever will happen. Let it be.
Nice. And how was your paper one? How a lot of students found paper one very difficult, and how was your response after the paper one? And did you discuss the questions after paper one, or what is your thought process after paper one exam was not very easy?
Sir, I feel paper one was little difficult, but not very difficult. Like if you have clinical concepts, there is one question on the protein requirement. That question was 55-year kg male, 55-year female. You should think about the process. We should give 0.8 grams per kg. We should think the process we have to check the answers below 55. In our PSM classes, they have told us that specifically for ladies, we should give 0.8. And it is usually 46. They have mentioned in arrays. The question came. And there was a diagram in there heart. And they mentioned about the hiccups. When they mentioned about the hiccups, we should just focus on the diagram about the nerve. We should mark the nerve. That's what I did in the exam.
The correlation was important, you're saying.
Yeah.
Nice. And what did you do in the lunch break? Did you try to study something, or did you try to stay calm and go back to the examination hall?
Nothing, sir. I did nothing. I sleep sometime half an hour, and I went to exam. That's it.
Nice. Were you confident after the exam? Were you having that feeling deep inside the gut? We have that feeling. Yes, I'll be able to clear this.
Sir, I will say I have said in the form that I will pass the exam, but I don't know how much will be. I have said like that, and confirm, sure, I will pass.
Nice. Mm. And did you happen to go through the recall? Arise made a recall of questions after the exam, and I think we came to two.
Yeah, sir. That gives me the confidence, because when I check the recall of the questions, most of the questions will right. I didn't check the score specifically. Like, I have checked the answers. Like, is this answer right or wrong? I have checked in that part, and most of the questions were right. So, I have gut feeling that I will pass.
Nice.
Then after they 3 years back, the results came. That day I was very tense, because I was in I have gone with my father to some lunch, and after I came back like around 1:30, my friend called me and said me that the results have declared. Have you seen? Then my heartbeat got raised up. Then I suddenly checked it, and it has seen like 178 marks. Then after I showed my mom, and I asked her to type my roll number and check once again.
Nice. How was your feeling at home on the result day? Like, I think they must be super happy after the result.
Yeah, sir. They were super happy. They were super happy because in our family, me and my sister only this much educated. Like, my sister also is a dental doctor. Like, she is currently 2nd year.
Nice.
Like, they are super happy that I became a doctor. Like, most in the family, around the family members, like some of the uncles, aunties, they will say that this is a very hard exam. Most of the people will not pass. Like that they used to say. But my father has a gut feeling that whatever will be my son will crack it. Like that feeling he has.
Awesome. Really
like
happy.
They never disappoint me in anything. Like, they wouldn't say anything until now, like you should prepare like that. Like that they will not say until now.
I'm really happy that you have made their dreams come true. It is a inspiration to all the students who are feeling isolated in this journey and all that people, and it is also an inspiration for all the teachers at Arise to be able to make that change and to be able to make that impact in your lives, right? We don't know your background. When we hear this, this is what keeps us motivated to keep doing it better, to keep improving what we do to our students. And these kind of stories really will inspire all the teachers listening to us also to understand the kind of responsibility that we are all into. And I can tell you did not disappoint your parents too. When they trusted you, you also put in back the same trust and cracked in the first attempt. And any suggestions, Dr. Sai-Ram, to future aspirants?
Yeah, sir.
Like, why do you think students are finding it so difficult? Only 10% pass percentage overall national percentage. Anything you felt about these are the mistakes from the students?
Like, most of them feel like చాలా మంది ఏమనుకుంటారంటే కనుక ఎగ్జామ్ లైట్ తీసుకుంటారు. అంటే ఏంటంటే మనం ఏదైనా పాస్ అయిపోగలం ఎగ్జామ్ ని. కాకపోతే ఏంటంటే మనం అన్లెస్ అండ్ అంటిల్ ప్రిపేర్ అవ్వకపోతే ఎగ్జామ్ అయితే పాస్ అయ్యేది చాలా కష్టం. ఎందుకంటే కనుక మనకి మినిమం నాలెడ్జ్ అనేది ఉండాలి దీంట్లో. ఇప్పుడు ఏంటంటే చాలా మంది స్టూడెంట్స్ ఏంటంటే బేసిక్స్ సరిగ్గా ఉంది. ఫస్ట్ వాళ్ళు అది బేసిక్స్ అనేవి ఎప్పుడైతే క్లియర్ చేసుకుంటారో వాళ్ళకి ఏంటంటే ఒక నాలెడ్జ్ వస్తుంది ఫస్ట్ దాని మీద. దాని తర్వాత దాని మీద కాన్సెప్ట్స్ ఎట్లయితే బిల్డ్ చేసుకుంటే అవి స్ట్రాంగ్ అవుతాయి. ఇప్పుడు చాలా మందికి ఇప్పుడు ఎరేజ్ అనేది మనకి ఫౌండేషన్ బ్యాచెస్ అని చెప్పి ప్రొవైడ్ చేస్తుంది కాలేజెస్ లో. అది ప్రతి ఇన్స్టిట్యూట్ లో ఉండాలి. ఎందుకంటే కనుక వాళ్ళకి ముందుగా ఒకసారి రివిజన్, ఒకసారి ఇది జరిగితే క్లాసెస్ వాళ్ళకి నెక్స్ట్ టైం మళ్ళీ ఇంతాకి రివిజన్ అనేది ఈజీగా అయింది. ప్లస్ ఏంటంటే ప్యాసివ్ మెమరీ అనేది క్రియేట్ అయిపోద్ది బాబు.
సో ఇన్ డెప్త్ లైట్ గా తీసుకో ద ఎగ్జామ్ ని, సీరియస్నెస్, కమిటెడ్ వర్క్ చేయాలి అండ్ స్టార్ట్ ఎర్లీ. దట్ ఈస్ ద మెసేజ్ దట్ యూఆర్ గివింగ్. అండ్ all the best, Dr. Sai-Ram, for your future success, and we are so proud of you, and it's been an inspiring story, and very happy to hear from you. Okay, all the best.
Thank you, sir. Thank you very much.
And anything that you want to convey to your juniors, to your fellow aspirants, or any special mentions of any friends that have helped you, or any names that you want to take?
Like, I will mention like my clinical teachers, like in the clinical department, Renu ma'am, Karuna ma'am, and Saraswati ma'am, like that. Like I have done my clinicals in Nepal. Like most of the teachers helped me, like a PG doctor.
They gave you full to work with the patients.
Yeah, sir. First of all, they diagnose the case. Then after, they will check like my knowledge. Like they used to give me like slit lamp and check the like is the cataract is right or not. Like that. Like I used to study over there most of them.
And convey our regards to your parents also, and tell your parents, tell your dad that we are so happy to have parents like this who support and who get who back up their children, and really happy to see you going back to your family as a licensed registered doctor in India. And we wish that all the future aspirants also get a chance to give this happiness to their family. Thank you so much. Wonderful talking to you. Okay, take care.